Bismillahirrahmanirrahim. Assalamu alaikum dear all students. I am Zakirullah, lecturer medical laboratory technology. Today we will discuss the next topic of is anemia and their classification. The outlines of today's lecture will be the introduction about the anemia, the normal blood values, and the clinical features, the signs and symptoms of the patient during the course of anemia. And in the last we will be discussing the detailed classification of anemia on the basis of different properties. Anemia, it can be defined as the condition in which hemoglobin concentration decreases below normal for the specific age and the specific gender of a person. So, if there is decrease in hemoglobin concentration, this condition is called anemia. The World Health Organization, it defines anemia for adults as hemoglobin concentration less than 130 gram per liter in male and 120 gram per liter in female, or we can say 13 gram per deciliter in male and 12 gram per deciliter in female. So this is the boundary, the lower limit of hemoglobin concentration, and below this limit, the person who has hemoglobin concentration below this limit, we can call him as a anemic person. The total circulating plasma volume as well as the total circulating hemoglobin mass, it determines the concentration of hemoglobin. To calculate the total plasma volume and the total hemoglobin mass, so from these two values we can calculate the concentration of anemia, and these two factors, they have the role in the concentration of hemoglobin. This is the normal values in case of male and in case of female. The hemoglobin normal values ranges from 135 to 175 gram per liter in male, and in female 115 to 155 gram per liter. And also these values depend on the locality and also in the ethnicity. For example, in certain region it is considered, the lower limit is considered as 120 gram, or in certain area it is 115 gram. So plus minus 5 is a variation in every area depending on the location, depending on the site. The red cells or the erythrocytes, in male they are found 4.5 to 6.5 into 10 to the power 12 per liter, and in female they are slightly lower due to their menstrual cycle. The packed cell volume or hematocrit percentage, in male they are slightly higher, that is 40 to 52%, and in female they are slightly lower. The other values, they are almost same in the male and well as in the female. The mean cell volume in femtoliter 80 to 95, mean cell hemoglobin 27 to 34 picogram, the reticulocyte count 50 to 150 into 10 to the power 9 per liter. The white blood cell count, it is also same in both male and both female. In case of adult male and female, they are 4 to 11 into 10 to the power 9 per liter. Neutrophils is 1.8 to 7.5, lymphocyte 1.5 to 3.5, monocyte 0.2 to 0.8, eosinophil, and in the last, the platelets is 150 to 400 into 10 to the power 9 per liter. So these are the normal values which have affect mostly the red cell, they have effect on the anemias and they are disturbed in case of anemias. The related different parameters to the anemia is the serum iron, that is 10 to 30 micromole per liter, the total iron binding capacity 40 to 75, the serum ferritin, vitamin B12, folate and red cell folate. All these values, they are disturbed and they varies depending on the type of anemias. The clinical features of anemias. The clinical features, their presence or absence, it depends upon the multiple factors. These factors are, the first of them is the speed of the onset of anemia. In cases where the anemia rapidly it is progressive, so these fastly progressive anemia, they cause more symptoms than the anemia who have slow onset or they are less progressive. So the speed of the onset of anemia, when the speed increases, so the sign symptom will be more, and where is there is a slow speed, so there will be less sign symptoms of the anemia. And also the severity, it also have effect on the clinical features of the anemic patient. In case of mild anemia, usually there is no signs or symptoms, but when the hemoglobin concentration it goes below 9 gram per deciliter or 90 gram per liter, so the sign symptoms, they appears and they are more clear and they are more visible as compared to the patient having mild anemia. Also the age have also role in the clinical features. Patient having age above 40 or older than 40, they accommodate anemia less well than the young because of their cardiovascular system. In case of the older patient, the cardiovascular system, they cannot compensate the deficiency in the hemoglobin and the supply of oxygen to the tissue, so there is a disturbance in their cardiovascular compensation. So the older patient, they less maintain or they less bear the condition of anemia. The last point is the hemoglobin oxygen dissociation curve. In this condition, the anemia is associated with the rise in 2,3-diphosphoglyceric acid in the red cells, and this causes a shift in the oxygen dissociation curve to the right. So when the oxygen dissociation curve it goes to the right, therefore the oxygen is given up more easily, more fastly to the tissue. For example, this is the normal oxygen and hemoglobin dissociation curve. When 2,3-diphosphoglyceric acid it increases, so this the oxygen partial pressure it also increases and the oxygen saturation of hemoglobin it also so decreases. Therefore the bond between the oxygen and hemoglobin it weakens. As the bond weakens, so the hemoglobin it easily breaks their bonds with the hemoglobin, and these oxygen they are fastly given to the tissues. So these four factors they have the effect on the sign and symptoms of the patient. The symptoms include the shortness of the breath, especially during physical exercise. A person who is anemic when he is doing any physical exercise, So during that exercise, his tissues need more oxygen and more energy for the cellular respiration. When the red cell, they are deficient of hemoglobin, so when the hemoglobin is deficient, so also the oxygen will be deficient. Therefore, a person will breathe fastly and shortly. So the first symptom is shortness of the breath in the anemic patient, and the other is the weakness, because every cell, they require oxygen for their cellular processes, and when there is a decrease in hemoglobin concentration, so this also affect the oxygen concentration within the body. When the tissue need oxygen, so this need will be fulfilled by the hemoglobin. So the tissue, they will become weakened by the decrease in the hemoglobin concentration. The third point is the lethargy. Lethargy is unable to do something, or the patient or the person who has anemia, he do not need to do, he do not wish to perform any kind of work or to do any work. Another sign symptom is the palpitation. Palpitation is the uneven pulse rate and the heartbeat of the patient. And headache. In anemic patient, the headache is also more prevalent, and also in older patient, the symptoms of cardiac failure, or there may be angina pectoris or angina intermittent, claudication or confusion. So all these sign symptoms, they may appear in the process of anemia. In certain cases, the visual disorders because of the retinal hemorrhage may complicate very severe anemia, and usually in rapid onset. The patient whose onset is very fast, or the anemia is very chronic, so this chronic anemia, this is complicated by disturbances in the eyesight. So these are the list of symptoms in the anemic patients. The signs may be general or may be specific. The general signs, they include the paleness of the mucous membranes or the nail buds when the hemoglobin concentration, it goes below 9 gram per deciliter. So there is a paleness of the mucous membrane and the paleness of the nail beds. The tachycardia increase in the heart rate being above 100 degrees centigrade. Also, due to this tachycardia, the pulse, it is bounding and it is very palpitable. Also, in older patient or in severe cases, there is a condition of cardiomegaly. Systolic flow murmur at the apex of the heart, it can also be felt, and congestive heart failure present in the elderly patient. These are the general signs of the anemia. The specific signs include the koilonychia, which is the spoon nails. The nails become engraved, slightly indented inward in the body, in the fingers. So this condition is called koilonychia. In case of iron deficiency anemia, this condition occurs. Jaundice, that is the yellowness, the paleness of the skin with the hemolytic or megaloblastic anemia. Also, in case of sickle cell or hemolytic anemia, leg ulcers, they are also present. And in case of thalassemia major, the bone deformities or disturbances in the bone, they also occurs. So these are the list of signs that occurs during the anemias. The classification of anemias on the basis of their morphology, it is divided into three groups depending on the morphology, and this morphology include the size of the red blood cells and the amount of the hemoglobin present in each cell. On the basis of these two morphological properties, anemias is defined into three different groups, and this anemia can be identified by measuring the absolute values, which include mean cell hemoglobin, MCH, MCV and MCHC and PCV, by examination that cell morphology or the stained blood films. First of these anemia is called the microcytic hypochromic anemia. In this condition, the red blood cells, they are microcytic. Micro means smaller than the normal cells, and hypochromic means they contain lower colored because the deficient or the decreased amount of hemoglobin. So in microcytic hypochromic anemia, the red blood cells, they are smaller as compared to the normal size, and their hemoglobin concentration is deficient as compared to the normal hemoglobin. All the absolute values, they are below normal. The mean cell volume, mean cell hemoglobin and mean cell hemoglobin concentration, all these three, they are decreased in microcytic hypochromic anemia. And example of these microcytic hypochromic anemia: iron deficiency anemia and thalassemia, sideroblastic anemia, and certain cases of anemia of chronic disorders. So these are the conditions in which microcytic hypochromic anemia occurs. Second type of anemia on the basis of morphology, the size of the red cells and the amount of hemoglobin it contains. In this type of macrocytic anemia, macro means larger and cytic is the size of the cell. So the red blood cells, their size is larger than the normal, but the amount of hemoglobin in each cell is usually below the normal. In this condition, the red cell indices, in which the mean cell volume, it is increased than the normal, and the mean cell hemoglobin and mean cell hemoglobin concentration, they are usually within the limits. And this macrocytic anemia, this anemia is commonly seen in megaloblastic anemia, aplastic anemia, hemolytic anemia, liver disease, myxedema, hypopituitarism, pregnancy and alcoholism. These are the conditions in which macrocytic anemia occurs. The normocytic normochromic anemia. This is the third type of anemia in which the hemoglobin concentration is the blood is slightly reduced, but the individual red blood cells, they appear of the normal size. All the absolute values, the mean cell volume, mean cell hemoglobin and mean cell hemoglobin concentration, they are usually within their normal limits as discussed earlier. This type of anemia occurs during acute blood loss, leukemia or the blood cancer, the bone marrow infiltration, chronic renal failure and the chronic infections or chronic disorders, chronic diseases. So these are the conditions in which normocytic normochromic anemia occurs. This is a chart which shows the classification of anemias and their normal values and the different types of conditions. The microcytic hypochromic anemia, in which the mean cell volume it is below 80 femtoliter. The mean cell hemoglobin it is below 27 picogram. This occurs, microcytic hypochromic anemia occurs in iron deficiency anemia, thalassemia, anemia of chronic diseases in some cases, lead poisoning, and sideroblastic anemia. Normocytic normochromic anemia, in which mean cell volume it is between 80 to 95 femtoliter. The mean cell hemoglobin it is more than 27 picogram in the normal limit. It occurs in many hemolytic anemias, anemia of chronic diseases, after acute blood loss, renal disease, mixed deficiencies, or bone marrow failure. The macrocytic anemia, in which the mean cell volume it is above the normal level, that is more than 95 femtoliter. This macrocytic anemia occurs in case of megaloblastic anemia, that is vitamin B12 or folate deficiency, and alcoholism, liver disease, myelodysplasia, aplastic anemia. So this is the summary of the classification of anemias on the basis of their morphological properties. That was all for today's lecture, and this lecture was prepared from the Essential Hematology by A.V. Hofbrand, 7th edition, published in 2006. Thank you for watching the video. If you have any question, you can ask. Assalamu alaikum. Allah Hafiz.